Good afternoon, everyone. This is Joseph Ray, Vice President of the Board of Directors for United Nursing Homes and Tribal Excellence. I want to welcome you again to today's meeting. As we've heard, our President, Tammy Reed, is unavailable, and our Secretary, Ina Hurley, is unavailable, but Mr. Ron Ross is on the call as well. He's the treasurer for our organization. So with that, I don't want to neglect anyone. Would the newest board members introduce themselves? Again, I don't want to neglect anyone else.
Hi, this is Lisa Johnson. I work with the Quinn QIO in the state of Alaska and have been part of U.N.I.T.E for a long time, but kind of dropped off for a little while we were between contracts, but I'm excited to be back engaged with this group. So thank you for having me.
Thank you, Lisa.
Hi, my name is Brandy Moran, and I work at the White River Health Care Center. We're owned by the Sioux Tribe. I have been here at our facility for about 15 years, and I've been in long-term care for about 6 years. I became the administrator here a few years back, and I work with Ron and program. And thank you for giving me this opportunity.
Hey, Joseph, it's Debbie. I'm not sure who's squeaking, but maybe if you're not talking, you could mute so we don't have so much background noise.
Okay, is Melissa Heflin on the call? Would you introduce yourself, please?
Hi, this is Melissa. I prefer to go by Johnson. I'm the Executive Director for Bering Sea Elders Group, but I have participated in the past with working to create U.N.I.T.E with under the direction of Kay Branch, of the late Kay Branch, and also working with Debbie Dijak and others on how can we get our tribal nursing homes together to continue serving our tribal members in more of an equitable fashion in the long-term care settings. And I'm based out of Anchorage, Alaska, but originally from Nome, Alaska. Thank you. Sorry I was on the wrong call-in line.
Okay.
This is Tiffany Sangru at Oglala Sioux Lakota Nursing Home, Pine Ridge Reservation. Thank you for having me.
Hey, Tiffany.
Hi, Debbie.
Hi, this is Deb Arbogast, Medicine Village in Eagle Butte, South Dakota.
Hi, Deb.
Thank you, Deb.
Nice pictures. Nice pictures on the newsletter.
So those who are new board members, bringing us up to a grand total of how many, Ron? How many members do we have now?
We have 11 people on the board of directors now.
11?
Correct.
Okay. And then are there any other attendees today besides who just introduced themselves? Anyone else that needs to introduce themselves?
Well, this is Jerry.
And then Sherry's on.
Sherry Schultz from LeadingAge National.
Okay.
And Julie.
And Jared.
Okay. Julie, I would imagine, is on.
Yes, I'm on.
Hey, Julie. Thank you.
So is that everyone?
Okay, so that's with you and me and Ron Joseph. That should be 1, 2, 3, 4, 5, 6. I'll just say Ron Joseph, Debbie, Lisa, Brandy, Melissa, Tiffany, Deb, Sherry, Jared, and Julie. Is that it? Did I miss anyone? Okay. Okay, thank you.
Thank you, Debbie. So we're moving on to our old business. Ron, would you give us that financial report?
Sure.
Please.
Yeah. Okay, so for the 5 months ending in May, we had generated $4,000. 4 of the facilities each joined at $1,000. We had some minor QuickBooks expense for the 5 months, and so we generated a margin of $3,650. Our assets at this time is we have $4,653.31 in cash. We have no liabilities, and so our equity position is also $4,653.31. That's through May, and through June so far, we have had $500 in membership dues, and then Blythe also put in $50 as a membership, and Lisa Johnson just sent $50 while we were on the phone, and so we will generate $600 so far in June.
Excellent, thank you.
So that's
Thank you.
the financial report.
Joseph, did we need to move to approve that, or I didn't know? I wasn't sure.
No, I don't believe so.
Okay, thank you.
The next bullet on our agenda is thank you, Ron, for that. The next bullet on our agenda is membership dues, which is $50 per individual and $1,000 per facility. So, is there another update that needs to be made on that?
I would just probably also under the website report, it's up and going, and the PayPal for both the donation and the membership is up and working correctly. And we've had 2 people who've come on through PayPal. And apparently Tori set that up so that when we did get a PayPal, a notice went out to the board members at the same time. So hopefully, I know Debbie, Tori did not get the J in between your 2 D's on your.
Oh.
So
I didn't.
I'll work with him on getting that corrected.
Okay. I think I did actually get something from PayPal when Lisa made her payment. I think I might have got that to my email. So.
Okay.
I think I saw that. I don't know if this is the appropriate time, but I did have something I wanted to ask on this membership piece on the cost. I don't know if I should bring it up now or if you want me to wait, Joseph, till new business.
No, go ahead and bring it up on this bullet since we're talking about it. The documents that I distributed earlier this spring with, I kind of reached out to all the different, nursing homes, assisted living facilities. Some of the feedback I got, especially from the assisted living facilities, were that they were so small that $1,000 just was like a lot of money for them. And I went back in my notes, and I don't know if we ever voted on it, but we did talk at one time about maybe reducing that a little bit for the smaller, like, assisted living facilities. Like, let's say they only have 10 people or something, as compared to a nursing home that might have, 50 or 60. So we thought maybe, I didn't know if there was a way that we could reduce that a little bit. I think at one time we talked about 500 instead of 1,000, but again, I don't know that we ever voted on it, so. I don't recall it either. What do you recall, Ron?
I recall that we do have the 500 for the tribes that just want to learn about having their own long-term care facility, either nursing home or assisted living, but we never specifically addressed assisted living. But I'm sure the board would be more than happy to do that. You know, something like $250 for the assisted living would probably be something. I know I would entertain that kind of a rate for assisted living, Debbie.
Yeah, because there were definitely some facilities that I spoke with that said, you know, they would really wanted to get involved in join, but $1,000 just seemed like a lot for them. So I didn't want to leave anyone out.
No, that's good. Thank you for that.
Yep.
I think at the Isleta facility, they only have like 6 or so persons also. I'm wondering if we should base a membership fee on their census. But like, that's a good round number, $250. I was thinking $200 myself, but again, that's not so big of a range.
Ron, do you know if there's any I don't know, for financial, like best practices, like as far as an algorithm or something to determine membership based on census? Have you ever seen anything like that? Maybe LeadingAge has something like that. I don't know.
Well, I don't want to speak for LeadingAge, but, you know, they have a tier where they tier your rate based on the revenues that you generate, and perhaps the board should consider something like that.
Right.
Okay.
The independent living center. Go ahead. I'm sorry. Go right ahead.
No, I was just going to say that seems like a very reasonable approach to have some kind of a sliding scale. So that's a great idea. Turf it back to the board.
Okay.
And this is Sherry. I am glad to share with Ron and Debbie and others some membership information that is how we decipher and what we use, how to calculate membership dues. And some of it is by categories. For example, like if you're an adult day program, we have a flat rate of $200. But the rest of, say, assisted living, skilled nursing, and so on are by a particular band structure. So I can share that with you all. I'd be glad to. Just let me know if you'd like to see it.
Awesome. Thank you.
Mm-hmm.
Okay.
Other membership dues are based on annual income for the programs.
Okay. Like net profits or something?
For us, it's actually program service revenue because it eliminates, excludes some dollars that we don't want to count towards the membership dues. So it's reported on for nonprofits on the 990 form to the federal government.
Okay. Okay. Okay, thank you.
Again, as per the recommendation, I think that's something we need to take officially back to the board of directors.
Okay, I'll put that in the minutes. We can discuss that at our July meeting. I'll have her put it on the agenda.
Thank you.
Okay.
And again, Ron, thank you for your contribution on behalf of the board members regarding our dues for the year. That's pretty awesome. And like Debbie suggested, each of us making an individual donation so that we can, again, just reaffirm our commitment. We don't have to, but again, it's just, again, way of backing each other up, I think. Whatever amount we can, bear. We don't have to, break our piggy banks. But again, thank you, Ron, for that. Thank you to your organization.
You're welcome, Joseph.
Okay. The next bullet is mailing address for correspondence. Is that regarding U.N.I.T.'s mailing address?
Ron, I'm not sure. Was that something Tammy needed?
I don't know, but I did visit with Tammy and say, if we have one place for correspondence, if we did get something, I obviously would want to get that information to her as the president.
So I think right now our mailing address is Ron's office in Nebraska, because that's what's on our official documents, right, Ron, that were filed for our nonprofit. So I think we have to use that as our official address.
Well, yeah, it would probably be best. And again, if there's a question directed to any of the board members or just to U.N.I.T.E in general, I would reach out to Tammy for her response to that communication.
Okay. Okay. So if we, as individual board members, if someone reaches out to us and says, hey, I'm thinking about this or that, basically just, forward that to Tammy with some explanation of what it is, so it can be, say, added to the agenda for the next board meeting, something like that?
Sure.
Okay. All right. I think the important thing is that we don't lose things, right? So if we have a secretary, maybe CC Ina as our secretary, we don't want to lose things that come to us, maybe requests or ideas or whatever. We just don't want to lose those.
Yeah, that makes sense, Debbie.
Okay, thanks.
So the same goes for the next bullet point, which is mailing address for treasurer business, I would just kind of assume.
Yeah, that would be the same thing, Joseph. It would just come to the address, and again, I would communicate with the board if there was anything, particular. But if something did come up, I'd put it on the board of directors' agenda too.
Okay. Okay.
Well, seeing into the future, there's going to be a day when we do need Tammy to have sign official documents when we're accepting money, or large sums of money. So, I'm sure that can be taken care of eventually. Whether, as you say, Ron, you have to forward it through a different, or if you, again, have to resend it back to Tammy, form or document. That's.
Ron, is DocuSign, is something like that, is that like really expensive to get?
No, I don't think it is. I'm not. I see the advertising all the time on my emails, but there are things that come my way that, they do use DocuSign, but, we could look into it.
I've used it. It's pretty slick. I just wondered what that would cost us.
I don't know.
Okay. All right.
This is Lisa, and I just want to apologize that I have to hop off. I have to facilitate another call at 11:30, so my apologies that I won't be able to stay the whole time. But thank you for having me, and I'll be there more in the future.
Okay,
Thanks,
so
Lisa.
our July meeting, it'll be the third Thursday in July. Yeah.
Okay, I got you on the calendar from now on.
All right, thanks.
Thank you.
Okay, Joseph, I think I've got the stuff on the address. I'll just put that in the minutes.
Okay. Next item, website report.
Yeah, it's up and going. It's working well. We reached out to LeadingAge. They gave us some ideas that we incorporated. We reached out to KAI. They had some technical things that we'll be working on with Tori. We appreciate their input too. PayPal's working well, and the feedback that we've gotten is it's clean, simple, and the feedback has been very positive.
Hey, Ron, what about, or I guess this is for Julie, what about our presence on the CMS.gov website? Is there anything we need to update or change or integrate with that? I know at one point we talked about getting our U.N.I.T.E newsletters there.
Yeah, so oh, sorry, Ron, I'm still on. I'm going to be jumping off after this update, but just to let you know, this is also available for other KI updates later on if asked. But for the website on CMS, KI is still kind of updating a lot of the pages on the Technical Assistance Center, and so we're still focusing in on that, but I will check in on the progress of that and then follow up with you all about what preferences might be in terms of what information should be on that page for regarding U.N.I.T.E.
Okay. Ron, can we feed our U.N.I.T.E monthly newsletters onto our website, or are they already there?
You know, if they're not, we certainly can, and I'll talk to Tori about getting that done. So.
Okay, good, because that's a lot of good information.
Oh, absolutely. Yeah, no, I'll get with him.
Okay, thanks. Okay. All right, Joseph, I got that.
Yes. So any other feedback regarding our website and how we might, any additions to it or any other feedback, again, regarding areas that maybe you think might be missing?
Well, I haven't been on it just in the last couple of days, but did we get all the board members' bios and pictures? Was that completed, or are we still missing some folks?
I don't know that there are pictures. And then as far as a full bio, I don't know that that's on there. It's just everybody but Lisa Johnson has their title and where they work and their city and state where they live. But and I'll get Lisa's stuff to Tori too.
Okay.
But that's all we have so far, Debbie. We don't have pictures and we don't have bios on the board.
I mean, even at the very least, maybe just for the officers might be kind of interesting so people can see what everyone looks like. You know, just maybe the officers even. Just a thought. I mean, it doesn't have to.
Well, he could put them on if people want to get us a picture, that's for sure.
Yeah.
That would be good to have updated photos if you can, and any updates, any new titles that you might have acquired in the interim. So
yeah, certifications, things like that.
Right.
Yeah.
Okay, moving on. Our next topic is the Native Nursing Home COVID-19 report, and I was letting everyone know, Debbie, that here at Laguna Pueblo, here in New Mexico, we at our Laguna Rainbow Center, we had a staff member test positive for COVID this past Tuesday.
Okay.
Unfortunately, the person had attended a funeral here in the community, and I guess just wasn't thinking when they came back to work. So again, we had another scare about 3 weeks ago where a staff member tested positive, but that one turned out for the best. There was no spread of COVID-19 in our facility at that time, and that person recovered.
Okay. So in terms of the work Blythe's doing, I know there's a call, right, Ron? I think it's next week, Wednesday.
Yes, and Julie went over that with the board just a little bit ago, but basically, Blythe is interested in all of us getting our weekly reports into her, and then she was going to have the first response back out to us on the information that she had gathered, and I believe that is on Wednesday, and I believe Julie was going to send us out the time and date and the number for us to get on. I believe it is Wednesday. Is that what you remember she said too?
Yeah. I'm pretty sure it's Wednesday because I know I wrote it on my calendar. So remember that is something that was kind of initiated by Dr. Bruce Fink with Indian Health Service, and Blythe just got things running. And do you know if people are using the link or form that was created? Do we need to kind of send that out again to our listserv, or is it being used?
I used it a couple times and then I forgot about it till yesterday. I used it again. So.
Okay, good. Yeah. Okay. I mean, I was it in the newsletter that just came out a day ago or yesterday? Was that in there? Was there a link to that in there in the newsletter?
Well, if it was, I didn't catch it.
Okay, Julie, are you still on the call?
No, she had to get off, but
do you think we should ask her, Ron, to maybe resend it back out just to make sure people are reminded?
Yes.
Okay.
Oh, and also, I'm here in of Joy. So, yeah.
Oh, who's on here?
Melissa from KAI in Portland.
Oh, okay. Would you see if Julie could just double check with Blythe and maybe just send that out again to everybody just as a reminder?
Yeah.
And when the call's going to be, just so people can have it on their calendars for next week.
Yes, I wrote that down.
Thank you.
Yeah, again, it's just so important that we report our numbers. But just so thankful that our facilities haven't been in the news. I think what really needs, again, is the constant reminders to our staff, various staff members, that they have to be on their utmost best behavior. And if they're going to be attending activities like the funeral, like this young man, I know he had a family obligation. He felt he had to be there, but in the overall greater scheme of the situation, he endangered so many people's lives. And so I think that needs to be a result of our reporting. Again, it's that education that needs to be maintained or improved or whatever.
Okay. Okay.
Anything else from the membership on Native Nursing Home COVID-19 report? Thank you. Hearing none, the next bullet point, Debbie, is the membership at the Mescalero Care Center. I haven't followed up on that.
Okay. Do you want me to do that since I made that initial contact with her? Because now that we have our website up and running, it would be easy for them to do a PayPal.
Well, do you recall what their census average is?
I want to say 60. I think that was correct.
Okay, cool.
Do you want me to reach out to her? Okay.
Why don't we both do that? I can back you up.
I'll send her a link to our new website because then she could just do it with PayPal. Okay.
Thank you.
You're welcome.
And Joseph or Debbie, can we get a push over to Archie Hendricks? I mean, I would think that they would want to consider joining.
I think, when Rosie was on our May webinar, she was pretty, someone needs to mute a little bit. There's some squeaky noises there. I think that Rosie was very much wanting to do that, Ron, so why don't I send her a quick email, see what I can find out.
Okay.
Okay. Anything else, Joseph?
No, not at this time, Debbie. Excuse me. I'm sorry. I was on mute. I was just saying we could move on to the next bullet, which is, to the next category, which is new business. Pardon me. We're now moving off old business to new business. But what we're hoping for is to get a report from LeadingAge.
Okay. LeadingAge, Sherry.
Ms. Schultz.
Yep. I believe Sherry's on the line.
Yes, I'm here. Hi, everyone.
Thank you.
Thank you for letting me participate in the call. LeadingAge, national partner, if there is one in your state. We are still having our COVID-19 calls Monday through Friday. You are welcome to join those if you need assistance. You can find that information. Much of our COVID-19 information is available at leadingage.org, and it's easy to find once you get to our website. It's the first item that appears there, and you can sign up for the calls and attend when your schedule permits, and then they're also recorded. So when you do have some time, you can listen to them at your leisure and also fast forward through sections every day, though we do have a member and some business partners that come on to talk about different scenarios on how communities are dealing with, as you all know, firsthand with situations with COVID, for residents dealing with separation, mental health concerns due to being separate from families and visitors, which hopefully are relaxing in some states at this time. I did want to let you know that the LeadingAge Annual Conference will not be an in-person event. It will be a virtual event slightly later in November. So it's an important change because I know that last year we were glad to have so many of you at the LeadingAge event, and we were scheduled to be in San Antonio this year, but unfortunately, due to the current circumstance, we made the difficult decision in many ways to have to turn that into a completely virtual event.
I have a question on that. Do you have an actual date yet, Sherry, or is that still a little pending?
Yeah, we do have an actual date, and I can share those out with you all. It's actually hosted over a 2-week period, and the reason for that is that we know, virtually it's difficult to be doing something for, several days. But it will be, it was just released, I believe it was on Monday. So it's I think it's the 17th through the 19th, Debbie, but I will be sure and send that to you all to share with in your newsletter.
Okay. Yeah, I'd like to get it into the July newsletter. Is KAI still on the phone?
Yes, I'm here.
Yeah, we need to let Julie know, make absolutely sure for our July newsletter that we get the LeadingAge website with the link to the COVID resources and also the link to the annual meeting, virtual. Yeah.
Okay, have that included in the. All right.
Sherry, I had another quick question for you. This is Debbie. Have you heard anything about the presidential commission that was supposed to be formed to talk about nursing homes? Were those people selected, and is that commission meeting?
I haven't heard if people have been selected at this time, but I can check in with Ruth Cass to see what her team's knowledge is of it, or Jody, and get back with you about that.
Okay, I'd appreciate that. Thank you.
Thank you, Debbie.
So that's all I have now, unless anyone has questions.
No, I look forward. This is Joseph. I look forward to that LeadingAge conference. Unfortunately, it's going to cause have to have U.N.I.T.E rethink our plans for our annual meeting. So that's the other unfortunate part of it. I
know. I totally agree, and of course we miss being able to be together as organizations and members and non-members all across the country. So it certainly will be a huge gap for networking and learning.
Would it, Debbie and fellow members, I was thinking that since this is, a different another opportunity for U.N.I.T.E to still reach out and collaborate with LeadingAge, if we could create some type of video presentation, Sherry?
I think that's possible. I can talk to our conference services team to see we can talk through some ideas, and then we can see what might be possible with what LeadingAge is doing and using a similar tool. Sure.
I'm thinking maybe some kind of greetings from, long-term care in tribal communities, something like more like a, more so than a formal presentation, right, Joseph? I don't know if he's back on mute again. Joseph, were you thinking more like just a, welcome, like something that could be run intermittently to keep us on their radar screen, or were you thinking more like a formal presentation?
Oh, I was just thinking of something short.
Okay, because we did get a response back from LeadingAge that we had put in submitted like a, to do a presentation, and that was not selected. So I don't know how, what we're saying would fit in with what's already scheduled. But I'm thinking maybe kind of like a, hello, how are you, remember us last year. Just a video greeting. Yeah, like a video greeting was maybe something.
I didn't know if that was already on the drawing board, but I think that would be cool. Anyway, thank you for that. So any other updates, if not from LeadingAge?
No, that's all I have today.
Thank you, Sherry.
Okay, and I had a question for Sherry from LeadingAge that Julie wanted me to ask, and that was, leading on to what you said earlier about including certain information on the news. Julie, going forward, you would like to submit or any resources or any updates for each newsletter going forward, each U.N.I.T.E newsletter?
I can't hear you really well. I'm sorry. Who is this?
Oh, I'm sorry. This is Melissa from KAI, and I was asking Sherry, and this is by way of Julie, if U.N.I.T.E would like to submit any type of resources or updates for each newsletter going forward. Not U.N.I.T.E, excuse me, if LeadingAge would like to submit any resources to U.N.I.T.E newsletter going forward.
Oh, certainly we can do that. If you want to share with me your time frame, I can partner with Jody
KAI. Yeah.
Mhm. And
Sherry, that would be good because it wouldn't have to necessarily go through us as U.N.I.T.E board. You could just go directly and send resources to KAI.
Sure. You just send me the details on the schedule of when you would need something and kind of the space that we would have, as well as who I should send it to, Julie or the staff there.
Thank you. Joseph, I'm really sorry, but I'm going to have to get off the call. This is Debbie, so if Jared could finish up the minutes, I'll send what I have.
All right, Debbie, we'll synchronize those minutes.
Yeah, I'll send you what I have first thing tomorrow, and then you can go from there. If Jared wants to add anything to him, he can. Thank you all.
Thank you, Debbie. Again, I guess moving on, thank you for that update, Sherry. Again, we're going to have to try and reschedule our U.N.I.T.E annual meeting, and that's kind of what prompted that thought about trying to at least send a greeting to the LeadingAge membership, if that was possible. Again, because we're it's going to probably end up, we're going to have our annual meeting is going to be through a Zoom call, unfortunately. But again, we want to keep our momentum and still host our annual meeting. I'm not sure if we still want to have it in November, our annual meeting, or if we want to. I guess as a board, we'll probably have to talk about that for the date of our annual meeting. What do you think, Ron?
Yeah, I think, maybe we'll know more in a couple of months. There's nothing to say we couldn't have it in December or January. And maybe if things free up, maybe we could get together in, Albuquerque or Phoenix or someplace warm in the winter.
Lincoln's not, Omaha's not warm, or Lincoln, excuse me, isn't warm in December?
The best time in Lincoln is probably mid-September.
All right.
So I think the board would have to talk about it, and, maybe if things free up, it wouldn't hurt to get together. And, there's nothing wrong with people coming together and sharing ideas, and certainly Arizona, New Mexico, whatever, would be probably a place people would be comfortable. I would think the Alaska folks would like to get out of there in the winter. But maybe not.
Well, again,
this would have to be a board discussion later on.
Right. And then our next topic, moving on, is an upcoming webinar with KAI. And is that going to be that will be in the July timeframe?
No, for Julie, she said that the webinar is June 24th.
June 24th, so that's like a week away.
Yeah, and it's on the Money Follows the Person Tribal Initiative.
Oh, okay. I see. Yes, I saw that today. that will be a week. Again, what was that? A week from tomorrow. A week from yesterday.
Yeah,
correct?
a week from yesterday. And then she also wanted me to mention, to ask about setting up a planning call for the July webinar.
All right. Yes, I think that's what I was thinking of more about that again. I knew that there was a June topic already picked, but again, the next webinar we're planning for, we'll have to reconvene as a committee to create the content for the next one in July.
Yeah.
Any ideas about a topic?
I think Debbie had some ideas, Joseph, and so we could probably reach out to her and pick her brains a little bit.
All right.
Who was that you mentioned you could reach out to? Or am I writing my notes?
Debbie Dijak.
Oh, okay. All right.
But if any other board members or any of the membership has any topics that they would like to bring up that they would like to see us address in one of these webinars, perhaps that's something we could also give consideration to.
Absolutely.
All right. So is there any other new business, board or membership? Do you have any other topics for new business that you'd like to bring up?
No, I was just curious if Lisa Pelusi had joined us so that we could get her on the list.
I did finally join in the last 5 minutes. I'm here.
Well, that's good. We can put your name on the list that way,
in
Lisa.
time for you.
No, thank you, Lisa. That was a little confusing getting all those
it was.
messages. I had to search around for that 800 number myself. So, but thank you for joining us. And again, what group do you represent?
So I just became a member of the board, I believe.
Okay.
Yes, and Lisa works with Liberty Healthcare, and she's out of Phoenix, Arizona.
Yeah, currently I'm working for Liberty Healthcare, but my background is I was a commissioned officer in the U.S. Public Health Service for over 20 years, and I separated from service last summer. So I worked extensively with Indian Health Service and CMS as a CMS surveyor, surveying nursing homes for a couple of years in the Region 8, which covers Colorado, Utah, Wyoming, Montana, North and South Dakota.
Welcome, Lisa. Thank you. You come highly recommended from Debbie Dijak. But again, we're thankful to have more voices and more experience coming to our board. Speaking of Indian Health Service, again, I'll bring up a little bit of new business. A few of us were on a call last week with the administration on community living. I think it was 2 weeks ago, right, Ron? Cynthia LeCount in her office.
Yeah, it was about that time frame, Joseph.
And again, the discussion was regarding tribal nursing homes. And it's always a fact. Tribal nursing homes and long-term services and supports, which includes assisted living facilities also.
Okay.
And you know, the discussion always falls back on how long-term services and supports is an unfunded mandate with the Indian Health Service, and you know that's really my mission with this board. You know, I'm on the board of directors here at Laguna Pueblo here in New Mexico with our 56-bed nursing home. I'm the vice chair of the board here. But again, I've been able to work on a national level, and I think this dovetails into our upcoming reports as far as our agency reports. I have a position with the National Congress of American Indians, which, you know, again, I'm using as an opportunity to reach out to our congressional leaders in the Senate and in the House. And I'm fortunate in my travels that I do get to meet many of the top tribal leaders. So we're trying to use all these resources to reach that level of funding, I believe. I know we're also trying other methods to seek funding for U.N.I.T.E, but again, to me, and my dream is that someday there will be a set aside for tribal nursing homes from Congress, that will have a budget that tribes will be able to tap into to provide those through Indian Health Service to provide those long-term services and support, and including financing nursing homes. So again, that's where I'm hoping to advance U.N.I.T.E, and I know other people have their own mission and reasons for being with U.N.I.T E, but again, that's where I'm coming from, Lisa. So thank you again for being with us.
Yeah, I'm here basically because I have a genuine interest. And just to get my foot back in the door in anything that's related to tribal, and nursing home is right up my alley. I have a passion for, you know, taking care of our elders, and anything I can do to help or assist the board with getting some of their initiatives moving or, you know, created, just looking at where they are timeline-wise, and anything I can do to help assist that along. That's what my purpose is for me having an interest in joining the board. Whether that be, you know, what's done in the tribal nursing homes or what's being done in sort of a policy avenue. Definitely I'm here to add my input to that. So thank you so much for giving me the opportunity.
Thank you, Lisa. Moving on, what is our time frame for this call, Melissa?
Well, I think it's done. We do an hour,
okay.
Joseph, and it's been an hour.
Oh, okay. So, well, again, we have. I don't think we have representation from NICOA on today's call. NCAI. Again, I gave my update. Our annual conference was canceled, so I just plan to introduce some resolutions in NCAI regarding quality of life and the ranking, the choices that hospitals are making regarding how they administer care to elders and people with disabilities, looking for some support there. And then the GWEPs, do we have anybody from the GWEPs on? I think that was Lisa or Ms. Johnson. Do you have any? Can you give us an update from the GWEPs, or is that you?
I believe she had to get off, Joseph.
Okay. And the Q10s? Anybody that can give us an update from the Q10s? No. Seeing none, how about from the Ombudsman? Anybody that can give us update on Ombudsman? I don't think we don't have anyone. right, moving on. Update from KAI.
Okay, so from the information I haven't mentioned yet, but I'll just mention everything again. That the content for the U.N.I.T.E monthly newsletter is due by the first Wednesday of each month. So that'll be July 1st. That the next content is needed. I mentioned I posed my question to LeadingAge about any resources they would like to include for the upcoming newsletter. Yes, that content would also be due if they for the next month's newsletter. That would be July 1st. I mentioned the next webinar, which is June 23rd. And yeah, the next part was about just setting up the planning call for the upcoming July webinar, which I believe it was Joseph said that we reach out to Debbie for any topics. That's all on my end.
All right. Thank you very much. Any administrators on the call that would like to give an update regarding their centers, please?
Hi, this is Deb Arbogast at Medicine Wheel. We did our mass testing and we remain COVID not detected in our building for our employees and our residents. And we are just right now looking at the new guidelines for state of South Dakota with the reopening phases and working with our department heads, and we'll have to work with our board and tribal health on that. But I do have another call I got to jump on here with the state of South Dakota. So it was good to be on today, and stay safe, everyone.
Thank you, Deb.
You bet. Bye-bye.
Hello, this is Brandy. I just wanted to, we did our mass, we're in South Dakota too, and we did do our mass thing. We didn't have anybody that tested positive with that, but did have an employee just recently that tested positive, but had not been in the facility and did not expose any of the residents or staff. We think the higher above that didn't happen. We just recently, with having a positive, even though they weren't in the facility, had to do another infection control survey on Monday, and we out deficiency free again, so we're pretty happy with that. So, and we are working on, yesterday they came out with the new regs on South Dakota on how to start our reopening. Thank you.
Thanks, Tiffany.
That was Brandy.
Go right ahead.
Okay, you waiting for me?
Yes, go right ahead.
I'm sorry. Oh, again, we had our mass testing on Monday, and we had the one employee that was positive. Everybody else was negative. We had a few residents that we had to test the next night, and a couple staff members that we missed from Monday, and those were all negative. So luckily, we're doing okay. We are moving a few of our dialysis patients. We're moving them down one hallway. We were told before move them to the end of the wings. We're lucky that we do have 4 wings in our building, because I know other people aren't as fortunate with the way their buildings are set up. So we're just moving our 3 dialysis patients down to the 1 wing where we have we'll use for isolation. If hopefully we'll never get the COVID, but that's our isolation wing. Other than that, just busy dealing with staff and families that are just asking questions. It was a busy week.
That was one of that. Thank you. That was some of the issues regarding our staff's low morale at times. But we had a visit from our tribal leadership to our facility, and that boosted the morale. Unfortunately, we again had a death in the community, and one of our staffers attended, and he was alerted that he was exposed. So, it sent everything back to the drawing board again. So we've had to call in the National Guard to come disinfect our facility here at Laguna. So that's where we're standing here at Laguna right now. So thank you. Any other updates from the board, members? All right. How about from tribal assisted living facilities? I don't think we have anyone on today from assisted living. But correct me if I'm wrong. All right. Not hearing from tribal assisted living. Our next topic is the U.N.I.T.E websites. And Ron, did you want to speak on that, please?
Yeah, I think we talked quite a bit about that already. Working with KAI, they gave us some good ideas that we're going to incorporate. But I think the website's up and going and doing well, and so I don't have anything else to add, Joseph.
All right. And so with that, I want to thank everyone again. We'll be talking on a quarterly basis. So that's going to be in September. If I'm not mistaken. Our next meeting will be September, and we'll be sending out notice on that. So with that, I wanted to thank everyone, and just stay safe, and we'll keep praying for each other, and we'll just keep working on behalf of our tribal elders. And so thank you to the membership, and thank you to the board members. Have a good day. Thanks, KAI.
Thanks, Joseph.